We'll now turn to Randi Gregory, Georgia State Director of Care in Action, an organization fighting for the dignity and fairness for the millions of domestic workers in the U.S., most of whom are women of color. She has been working on progressive issues for the past 9 years as an electoral, union, and issue based organizer. She is a Gates Millennium Scholar and a proud member of Gamma Phi Delta Sorority Incorporated. Welcome, Randy.
Yes, but hi again. I was saying that I appreciate the shout out to Dorothy Bolden earlier, who founded the National Domestic Workers Union of America, and she's from here in Atlanta. And so we can, I assume y'all can see my slide. So we can go on to the next slide about the National Domestic Workers Alliance. So NDWA, we're one of the largest workers' rights organizations in America. We have over 60 affiliate organizations all around America. We started in 2007. We started with a staff of 8, and now we have, I believe, almost 90 folks on staff. We also have the NDWA Labs, where we work on technology that can help domestic workers, like ALEA, which is a program that we started to help give cash benefits to domestic workers. Because I'll talk a little bit later about why they would need things like that. But yeah, so NDWA is an organization that was built to help the most marginalized workers, domestic workers. And so we've been doing advocacy and organizing around that, like I said, for the past 13 years. And we can move forward to the next slide. And so Care in Action is the sister political organization to NDWA. And we can move on. We can move forward to the next slide. Okay, so Care in Action was founded by our executive director, Aijen. She's the executive director of NDWA. And so she founded Care in Action so that we could more be involved in a more explicitly political way, so that we could organize around specific legislative issues, and that so we could help support specifically women of color candidates. So we can move forward to the next slide. So who are domestic workers and caregivers? And we can move forward to the next slide. So every day, over 2.5 million nannies, housekeepers, and care workers do the work of caring and cleaning in our homes. And domestic workers are the nannies that take care of our children. The house cleaners bring order to our home. And the care workers ensure that our loved ones are able to stay at home and live independently in dignity. And most of these workers are majority women, mostly immigrant, and mostly women of color. And so we can move forward to the next slide. So when most of our country's labor laws, like the Fair Labor Standards Act, were drafted, domestic workers were deliberately left out. Workplace standards like a minimum wage, overtime pay, or protections against sexual harassment in the workplace are rarely extended to domestic workers, if at all. Many domestic workers do not earn a living wage and work without access to health care, paid sick days, or paid time off. And because domestic workers' unique workplaces inside other people's homes, the living wage and the struggles domestic workers faces are largely out of the public spotlight. Domestic workers take care of what is most important to us, yet they are often the least valued and the most vulnerable. And we can move forward to the next slide. So what does Care in Action do? So as I said, Care in Action right now, we have been running a huge voter registration program, a huge voter outreach program to women of color. We are working on endorsing women of color candidates and supporting them through donations, through giving them basically outreach for phone banking and canvassing. And so a lot of the times when we are thinking about the the candidates that we want to endorse, some of the issues that we like to focus on are reproductive justice issues, as everyone has been speaking about earlier. That's a very important part of NDWA and Care in Action's focus. And so we always ask candidates, what is their stance on reproductive justice? What is their stance on abortion, on affordable health care? And obviously, we want to know candidates' stance on care in general. We are for, as I said, child care, for elder care, for paid parental leave. And so we want to be able to make sure that we can support candidates that are going to support those issues that most affect women of color.